Do you know what these things are? Odds are, if you don't work in healthcare, you've never seen or used one of these before. This is a sub-Q butterfly, and it's used to administer medication under the skin to avoid having to give an injection every time we're going to give a dose. We use these a lot in our end-of-life home care clients to manage symptoms with the family administering medication without having to do an injection. So for these, we put one under the skin and we pre-measure the doses in the syringes so that they can administer it through here without any question of drawing up meds or things like that. It takes away the judgment that they have to make, ideally. I'm going to do a bit of a series on sub-Q meds and setups and things like that, but today I want to talk about a patient we had over the holidays and dosing. So the patient we had an order for 2 milligram per mil hydromorphone concentration with a dose of 0.5 milligrams to 1 milligrams sub-Q. That's 0.25 to 0.5 mils. If I were drawing that up personally, I would draw up all syringes that were 0.25 mils, the 0.5 milligram dose, and tell the family in a pain crisis or extreme shortness of breath, they could give 2 of them since the doctor's preference was to stick with the 0.5 milligrams as much as possible. However, I was surprised when I got out there to see that all the syringes had been pulled back to the 0.5 mils and the family advised to give half a syringe for each dose. This may not seem like a big deal to those of us working in healthcare. We can judge those things, but we need to remember our population that we're working with. Typically, people who are facing end of life are much older, and therefore the caregivers are also older. But even if they're not, usually it's people who have no experience in healthcare, have never administered medications like this before, and have never even connected the syringe to a needleless adapter, which takes a bit of teaching. So when you're doing that, and then having to slowly inject, as they were told, down to the 2.5 on someone with a port in their arm that is moving and agitated and restless, it's a big challenge. So we want to make this as simple as we can, which is the point of today. I want to remind everybody, and also teach families so that they know what they can ask for, that we want to make this simple. These are the final moments they'll have with their loved one, and we don't want there to be questions of, did I accidentally give too much? Did I do it wrong? Did I manage the symptoms well enough? And we can eliminate, or mostly eliminate, those questions and those worries later by providing appropriate education and setting them up for success with things like pre-measured doses that are the actual doses they're giving so that they don't have to make any judgment calls. I know that it can seem like a little more work having to pre-fill more syringes at that 0.5 than if we fill up the 1 milligram doses, but in the grand scheme of things, it could make a huge difference for somebody else. And to me, that's worth it. So just wanted to point out the thoughts and the experience that we're dealing with when we're providing this education to ensure that we can set people up for success. Like I said, I'm going to do some videos on sub-Q setups and the different possibilities and how I set people up for success. But if you have any suggestions or questions, feel free to leave them below and I'll do my best to answer.